you thinking about treatment for hepatitis C? Hi, I'm Lisa McGuinness, a member of a research team at the University of British Columbia. In this presentation, we'll look at some questions to ask when you're getting ready for antiviral therapy. The better you're prepared, the more likely treatment will succeed.
Like I didn't know anything about it, I just saw the numbers. I just went, I know that's not good because the numbers were through the roof. And you know, it gets you thinking, you know, like, what's the treatment and that, and if there is, then how long does it take? You know, is there a way to cure it, and that sort of stuff.
We really need to spread the word, both to the general public and people living with Hep C and the social service and healthcare community, that there are treatments, that Hep C can be cured, and that we can do something about it.
First, speak to a healthcare provider to get important information. For example, you may want to know about treatment side effects and the best way to deal with them. Other helpful questions to ask may include: how long will treatment take? How will treatment affect my daily life? Which genotype, in other words, what variation of the Hep C virus, do I have? Having good information and the support of healthcare providers can make treatment decisions easier.
As far as education from professionals, it was great. I did not experience any misinformation. It was explained very clearly. So you know, maybe that is also the reason I decided to treat. I felt and I continue to feel very confident with my healthcare professionals that they're guiding me in the right way.
Getting your body ready for treatment is important. Ask your healthcare provider about what this might mean for you. Some questions to ask may include: do I need a dental checkup? Do I need an eye health exam? Will I need to see other healthcare providers?
The first thing I had to do was get my teeth fixed. With the liver clinic, you have to have everything fixed before you can go in the treatment. The treatment is so harsh that they have to know that you're not going to fail.
Treatments for hepatitis C are becoming more effective, but they can be challenging, not only physically, but emotionally too. To help you stay with treatment, ask yourself, how do I deal with difficult times or feeling down? If I need support, where can I go?
I deserve to live and I deserve to feel good. When you need long-term help and have basically no money, it's even more important that, maybe this sounds kind of funny, but I think, you know, that to work internally on your spirituality and your relationship with yourself and other people, I think helps a lot.
Getting emotionally ready also involves making up your mind. Ask yourself, do I really want to be on treatment? Will I see it through even if things get difficult? What will motivate me to stay on treatment? Having your mind made up will help you through the ups and downs.
It took me quite a while to decide to treat. My husband was treated first, and then he got sick, and so I would say it took me probably about 5 years to decide to treat. And yeah, at least 5 years. I kept probably, at that point I was procrastinating and putting other things as a priority. My husband.
There are also practical things to help you get ready. Treatment will be easier to manage if you have your stuff in order before you start. Do I have a safe place to live so I can rest? Can I always get food when I need it? Other things to think about are, do I have a fridge to keep my medication cool? How can providers leave me a telephone message? How will I get to appointments?
Finding a balance is a personal key. But for the majority of people, just putting together enough energy to keep a roof over your head and food in your stomach will consume your whole day. So until we have the basic hierarchy of needs met, food, shelter, and a bit of safety, people can't even start going beyond that to look for help for their overriding health issues.
You don't have to do this alone. Others can help make daily life easier and be a source of encouragement throughout treatment. Ask yourself, who are the people that care about me? How can they help me get through treatment? Where can my supporters go if they have questions or concerns?
Like I said, it's the support and sharing and getting knowledge from one another and answers on how to deal with things and what to do, or giving advice from things that I've learned.
It's important that you have enough money to live on while on treatment. Preparing now can help reduce financial pressure later. Some people have found it too difficult to work and go through treatment at the same time. Ask yourself, do I have any medical benefits that will cover my treatment costs? Will I need to apply to get disability benefits while I'm on treatment? If your work is seasonal, ask, when is the best time for me to start treatment?
Our experience with our patients have access to the treatment. They all have access to the treatment, and we make sure from the beginning that there's no loops along the way, because once you get started on treatment, you can't stop. So we get the patient, get all the information we need. If they have private insurance or they're with a government insurance, or they can afford the percentage that they're supposed to pay, we enroll them on the programs that are available. Once we have all the paperwork ready, and we always tell the patient we are not going to start until we make sure all the paperwork is ready, because we never know what could happen all of a sudden.
The last time I actually worked right through it, and hindsight, it took a lot out of me, and so I think this time I'm hoping, if I can afford it, to limit my work.
Your support team is more than just your healthcare provider and may include social care or mental health providers or people from other organizations. Think about who can help me and how. Ask yourself, what kinds of supports are available? Who can help for things like getting groceries or to check in on me? Who can I call in an emergency?
We've really worked on making partnerships in our community so that we know who the mental health professionals that people are going to be dealing with. We know the doctor's office receptionist, and we know the pharmacist that people are going to be going to, so that we can work with those people to try to make healthcare seamless for the patient.
Is your daily life ready? It's not just about if, but when. Ask yourself, should I delay treatment for a while because there's a lot happening in my life? Am I planning to start a new job or school? Do I have responsibilities I'll need to get help with, like taking care of young children?
If a patient doesn't have any risky behavior, and if there is no damage in his liver, once he knows that, maybe for him, he finds it's better to wait. We're going to respect that. Even if we think that to have the treatment would be a good thing, it's better for us to say, okay, you want to wait, let's wait, instead of saying, no, I think you really, really should be treated now, and then everything goes wrong, you know. But if we plan that and wait until the patient is really ready, especially in his head and in his soul, you know, so.
We've covered lots of questions. Please take your time in thinking about them. A workbook to further help you to get ready for treatment is available at www.bccdc.ca. Type Attendance Project in the search box. Thanks for watching.
Go to your healthcare provider and get the information that you need and seek treatment. And 2, don't be ashamed of it. Talk about it, but don't be ashamed of it.